Hello, I'm John Brisson, author of Fix Your Gut and Health Coach. Welcome to the Fix Your Gut YouTube channel. Today we're going to talk about a topic that I find to be very important because there's not a lot of information of it on the internet or in many medical books, which is Roemheld syndrome. Now, I suffered from Roemheld syndrome myself, and it was hell on earth, and I wouldn't wish it upon my worst enemy. After my son Abel died years ago, I was put through the most amount of stress that I have ever been put through in my life. And because of that, the gastrointestinal issues that I was still having from H. pylori dysbiosis that I had not figured out yet, it ramped to a halt. My silent reflux got much worse. My blood pressure and anxiety were through the roof. And, things were bad, but it started getting really bad. I started having issues where I felt like I couldn't catch my breath, which a lot of people do tie that to anxiety. And I felt like I just couldn't breathe properly. Now, I've had panic attacks in the past. Not now. Magnesium supplementation, once you get your magnesium levels upwards, and godsend for that. But nonetheless, at the time when I was having digestive issues, after Abel had passed, it was horrible. I remember sitting there and just sitting down watching TV, and I feel like I couldn't breathe. Like if I ate like a really big meal, and all of a sudden I feel the rush of adrenaline hit through me. My blood pressure would shoot through the roof, and my heart rate would shoot through the roof too. It would maybe very, very high sinus tach, or even maybe supraventricular tachycardia. I mean, my heart rate would go above 150 beats per minute, and it would sustain that way for a few minutes, and then eventually it would come back down. And it was hell. It would wake me up in the middle of the night. I felt like I couldn't breathe. I felt like I was going to die. Heart rate, blood pressure would be through the roof. And the anxiety was second. It wasn't primary to what was going on. And I noticed a few things, correlated a few things over a period of time. If I sat down, relaxed, and I consumed water and made myself burp, I felt better. When I took magnesium, I felt better. Also, my Roemheld syndrome symptoms sometimes would be triggered right before I had to have a bowel movement, and because that puts extra, intra-abdominal pressure most of the time when you have to have a bowel movement. And when I'd have a bowel movement, it would go away. I also started noticing, once I actually slowed my breathing down, started eating less, started taking more magnesium, that these symptoms of Roemheld syndrome would disappear and go away. So at the time, I was researching on the internet like crazy. I was trying to figure out, I was like, what the heck is wrong with me? And I came across this podcast, which I did link it in my Fix Your Gut article about Roemheld syndrome of Superhuman Radio. I don't remember exactly what episode it was, but it was on Roemheld syndrome. And when I went and Googled all my symptoms, and then I was like, well, crap, that sounds like what I have. So what are symptoms of Roemheld syndrome? Well, symptoms of Roemheld syndrome usually happen around a person, usually after they've consumed a very big meal, or in the middle of the night when they're sleeping. Maybe they ate something before they went to bed. So usually the symptoms are, sometimes it can be a decrease in heart rate, where it goes down to sinus bradycardia, which is under 60 beats per minute, and then it shoots back up into sinus tachycardia, which is over 100 beats per minute. Some people may have hypotension. Some people may have hypertension. Some people may get PVCs, or a feeling of skip beats in their heart, known as premature ventricular contractions. Some people may feel like they have heart arrhythmia, maybe chest pain. Anxiety is usually associated with it. It was for me. Worsening gastrointestinal esophageal reflux disease symptoms, or reflux symptoms in general. Sleep disturbances, fatigue from lack of sleep, trouble breathing, or feeling like a person cannot get a full breath in. And we'll talk about anatomically why in a minute. I call that perceived breathlessness. When a person, you check their oxygen on a pulse oximeter, and their oxygen is normal, but yet they feel like they're not breathing well. It doesn't seem like they feel like they can't catch their breath. Hot flashes, my face would flush. may worsen symptoms like vertigo, tinnitus, visual snow, and it could even possibly, if worse enough, the reason why they call it gastric-cardiac syndrome, could cause A-fib, a heart attack, or even sudden cardiac death. The heart just goes into a very unusual arrhythmia pattern and just stops, which that's extremely rare, but it possibly could happen. So why is that anatomically? Well, there was a German internist in the 1930s. His name was Ludwig Roemheld, and he discovered that when people were having gut issues, they were also having heart issues too as well. And so the reason why it mostly happens for a lot of people when they've consumed it, after they've consumed a big meal, maybe 30 minutes to an hour afterwards, or if they have a lot of gas production, a lot of bloating, or if they're sleeping, is because the stomach, especially if you eat a large meal, it can put a lot of excessive inter-abdominal pressure. And when that happens, the stomach moves upwards. Now, anatomically, some doctors will say, well, that's a hiatal hernia. The stomach will go into the into the lung cavity, which is true. Gastric-cardia to some degree is technically a hiatal hernia in a lot of the cases. But nonetheless, what happens is the stomach moves, it puts pressure on the diaphragm and on the lungs, and it worse enough, since everything is shifted upwards, it puts pressure on the heart. And when that happens, it can also move back a little bit and put pressure on the vagus nerve. So when all this is happening, especially if you're putting pressure on the vagus nerve, you're going to get a wide range of blood pressure and heart rate fluctuations and anxiety and feeling an impending doom, a malaise, like something is going wrong. And if it's pressing on your diaphragm and your lungs, it's not like it's affecting your lungs' ability to breathe. It just makes you feel that way. So exactly, your pulse oximeter is normal. It's not like you're having asthma, you're not having airway constriction or anything like that. It's like someone pressing down on your chest. And if it's pressing upwards further and putting pressure on your heart, that could trigger abnormal contractions and arrhythmia and chest pain and everything else. So that is the symptoms of Roemheld syndrome. Now, usually you can tell if it's Roemheld syndrome is if the person feels better if you can make yourself burp, or if you're laying down. Some people with Roemheld. Okay, so when you're sleeping, if you've ever looked on blogs about GERD and sleep or reflux and sleep, okay, most people say that if they sleep on if you sleep on your left side, it puts pressure on the stomach and it keeps the LES closed, which is true. But in people with Roemheld syndrome like myself, that puts more pressure on maybe a distended stomach or a bloated stomach, and it pushes it more further upwards. And in doing so, that may trigger the symptoms. Where if you fell asleep or lied on your back during sleep or on your right side, it doesn't. It's like the opposite for Roemheld syndrome. And it isn't like that for everybody with Roemheld syndrome, but for many people it is. So you could try that. Definitely do not sleep on your stomach. No one should sleep on their stomach. It's bad for oxygen. It's bad for digestion. Just no. You either sleep on your side or on your back. But yeah. So usually, if you're sleeping on your left or on your stomach and you have a Roemheld trigger, sit up. Sit up, maybe get up and walk around, try to make yourself burp. Like I said, maybe drink a little bit of water, try to get yourself to burp, and it should stop. Or it should limit itself. Now, ways that you can prevent this happening is if you have a hiatal hernia, you might want to lose some weight if that's causing it, or you might want to go see a very good chiropractor in your area with good reviews and have them manually manipulate your stomach back down in the correct anatomical position. Show you different ways that you might be able to do that. Some people like bounce on a rebound trampoline, for example. Might be something you want to do. You also want to, if you're dealing with gastric-cardia syndrome, you want to make sure that you're not constipated. You want to relieve your constipation because constipation will put more pressure on the abdomen. If you have any upper gut dysbiosis like H. pylori or anything that's causing bloating in the stomach or a lot of belching, you want to reduce that so that you have less gas pushing the stomach upward. Taking activated charcoal after meals may help as long as it doesn't constipate you. And there's a YouTube video and a blog that I have on activated charcoal and its many uses and when you should use it. That may help. Taking magnesium may reduce the anxiety associated with Roemheld syndrome. Magnesium malate helped me greatly with that. You want to make sure that when you eat very slowly. You don't want to stuff yourself. And you want to make sure that you chew your food very well to prevent this, excess pressure from overeating, or and make sure that you eat correctly. And in doing so, that helps. You don't want to drink a lot of water with your meals. You want to try to drink that in between meals if possible. You don't want to drink a lot of water before you go to bed because it will fill up your stomach and put more pressure. All these things you can do with gastric-cardia. Also, if you're having a little bit of dyspepsia or maldigestion and you're having a lot of bloating, if you want to take some digestive enzymes, that may help too as well. If your stomach pH is high and you might want to, if you're dealing with upper gut dysbiosis, take some capsules of betaine HCl to help reduce the dysbiosis and decrease your stomach acid, which would decrease your stomach pH, should I say, which would decrease fermentation that happens in your stomach, which will reduce your bloating. All of these are things that you can do for gastric, to help with Roemheld syndrome or gastric-cardia syndrome. I think there's many different causes for gastric-cardia syndrome, like I talked about. Hiatal hernia could be one. SIBO, some people with SIBO will have it. Some people with upper gut dysbiosis will have it. If you've had a gastrointestinal surgery done, like a nice infundibulation, you may have gas bloat syndrome and being unable to burp. That can cause it. Gastric bypass surgery complications can also cause it. Being overweight could be a trigger for Roemheld syndrome. And having an abdominal hernia repair and mesh, like yours truly, that could also possibly cause it too. So those are many different causes and many things that you can try to do for your Roemheld syndrome. One last thing I'd like to mention is many different breathing exercises. I have a link to my blog of people can do also to strengthen their diaphragm. So you have less abdominal breathing and a stronger diaphragmatic breathing, and that may help with the perceived breathlessness associated with Roemheld syndrome. But yeah, Roemheld syndrome is scary. Trust me, I lived with it. I don't wish it upon my worst enemy. When you're having digestive issues and your heart rate shoots up to 150 and you feel like you're going to die and you can't breathe and you're having heart issues and your heart's skipping beats, yeah, it's not fun. But, once you recognize that this is what it is, that it is Roemheld syndrome, that it is gastric-cardia syndrome, then you can take these steps that I mentioned and you can go to fixyourgut.com and look at what I've written about Roemheld syndrome, and I'll put the link below in the show notes, and you can try to get over the condition yourself and try to improve your health. As always, if you like the content of this video, please like, share, and please subscribe to the Fix Your Gut YouTube channel. I hope you enjoy the rest of your day.